I'll call this regional council meeting to order. We acknowledge the traditional territories of the Dene and Cree people of the Fort Nelson First Nations, whose traditional territory is located at the heart of the Northern Rockies Regional Municipalities Administrative Center. We also acknowledge the many Indigenous nations with traditional territory in Northeast British Columbia and the enduring presence of the Métis community. Please be advised that tonight's meeting is available for the public to attend virtually. It's being streamed and recorded. Should virtual attendees wish to address council either during the public comment period or the question and answer period, use the raise hands feature on your webinar controls. When it is your turn and are prompted, unmute your microphone, state your name, and ask your question. Once your question has ended, you'll be muted again. I have one addition to the agenda tonight. Any council additions?
Yeah, I have two, excuse me, the residents' medical letter and Dr. Mostert's request for assistance.
Thank you. Are there any CAO additions?
No, Mayor.
Very well. I'll ask for a motion to adopt the agenda as amended. Moved by Councillor Penny, seconded by Councillor Roper. All those in favor? Carried. Motion to adopt the minutes of the Special Regional Council of September 23rd, 2022, Special Regional Council of October 11th, 2022, and the Regional Council meeting of October 11th, 2022. Moved by Councillor Roper, seconded by Councillor Andrews. All those in favor? Carried. Are there any comments from the public? Thank you. Administration report number 79, development variance permit for 5360 41st Street. Ms. Adhikari.
Good evening, Mayor and Councillors. Pursuant to Council consideration on October 11th meeting, a notice of development variance permit application was sent by mail on October 12th of 2022 to all property owners within the 110-meter radius of the subject property, fulfilling the legislative requirements. So far, no comments or concern has been received for this one. Also, in response to the questions raised by Regional Council at October 11th meeting, general information related to setbacks has been provided in the report. And additionally, Regional Council questioned whether the shed could be moved to meet the setback requirements, and staff communicated with the applicant, who confirmed that although there are some challenges, but the shed could be adjusted to meet the setback requirement. If there are any questions, I can answer them.
Are there any questions, councillors? Very well. I'll make the motion the development variance permit be approved, allowing the relaxation of the height requirement of the accessory building. I understand that they can move the building, so that will be the motion. The seconded by Councillor Penny. All those in favor? Carried. Thank you.
Thank
Mayor
you.
Foster, just for clarification, so council's denying the application to vary the
Setback.
setbacks. Okay.
So that's option one, right? Is
Yes.
okay.
Admin report number 80. Northern Rockies Regional Hospital District. Ms. McIver.
Thank you. So apologies for the lengthy report, which basically goes to say that it's been recommended by legal counsel that the NRM make some adjustments to our administrative practices and our budgeting practices to effectively separate the regional hospital district business from that of the NRM. So as council is aware, at the top of all of our agendas, it says Northern Rockies Regional Municipality and Northern Rockies Regional Hospital District. it's been like that for quite some time. Predates me and most of us from the table. So essentially what came to light was that that's not an appropriate reflection of the Regional Hospital District Act, which explicitly notes that regional hospital district boards consist of members of a regional board, or in our case, the regional council, but is not one and the same. So there's a couple of practices that will have to be embrace moving forward. So one is which an annual appointment of regional hospital district board members from among council. Another is the appointment from that board of a chair. So it's not just the natural appointment of the mayor as the chair of the hospital district. And then there'll need to be some procedure bylaw amendments to basically summarize that practice. So since writing this report, we've had further discussions internally. And while there was kind of equal examples of communities that consolidated their hospital district procedures with their regional board procedures to one procedure bylaw, there were as many examples where they're separate. But what we came down to, I think, among us was that just in the spirit of separation, it would make sense to have a procedure bylaw for the hospital district and a procedure bylaw for the NRM. So right now our procedure bylaw does reference the hospital district, and it would be recommended that we strip that out and create a simplified version for the hospital district board. Within that procedure bylaw, it identifies that it would need to identify how often the regional hospital board would meet. And we would recommend that basically it would be quarterly and just be at 6 p.m. just ahead of our regular meeting. The other major change is around the budget preparation. So as council's aware, although we have we have followed the Hospital District Act in terms of timing in approval of the provisional budget and then subsequent the annual budget for the hospital district. We've more or less combined the two functions within the presentation of our budget. So it's recommended that those also be separated out. And then lastly, the activities by which we've levied funding under the Hospital District Act don't meet the requirements of the Hospital District Act. So the Act specifically talks about that hospital districts exist for funding equipment for facilities, equipment related to hospitals. And as we all know, we've funded a lot of our health initiatives through the hospital district budget, including our physician recruitment program, the Community Health Plan Steering Committee fees, coordination fees, and things like that. So it's recommended that we take those out and budget for them separately within a municipal budget. I think in a nutshell, that's that report, but if council has any questions, I absolutely invite them.
Any questions for Mrs. McIver? Councillor Souls.
I just have a comment. I actually think the idea of creating a separation is a good idea. I see from a personnel point of view, the mayor automatically being the chair of the board, we really always have tried to, in all of our committee work, to have the right person at the table for the right job. And if we can do that, that seems silly to just have this as a blank setup already where the mayor is sitting at the chair as a chair.
Any other comments? Councillor Gerby.
Like I have a million, but I'm not going to do them tonight. I just want to go on the record as requesting that we be kept informed as to possible transfer of any funds that we can legally transfer, because we were obeying what we thought were the rules of engagement And that's why the funding is left there to fund all of these projects. And so I know staff will do everything that they can to, within the legal limits, to ensure that that money is transferred if it can be. So just want to go on the record asking to be kept informed as to the process of that.
Any other comments? Councillor Souls, you want to make the motion for the recommendation? Seconder, please. Seconded by Councillor Andrews. All those in favor? Carried. Ms. McIver, admin report number 81, general local election results.
So based on our legislative requirement to bring back the election result to the local government, you have it before you, and we'll save ourselves a special meeting between now and November 19th. So effectively, as you all know, we had 2 candidates for mayor, we had 9 for council, and we had 7 for school trustees. We met all of our declaration requirements within the timelines mandated by the Local Government Act. We held advanced voting opportunities on the 5th and the 12th, or sorry, on the 5th, with a special voting opportunity held on the 12th in Toad River. Sorry, the 5th and the 12th were the advance, and the special voting at Toad was on the 7th. And general voting day was on the 15th. As you all know, the outcome of the election has new Mayor Rob Fraser to be sworn in November 7th, along with the 6 members of Regional Council, 4 incumbents, Kyle, Lorraine, Danny and John, and with Brenda Enax and Leslie Dickey as the newly elected council members. And the School Board of Trustees also saw some new faces. There were 3 incumbents, Bill Dolan, Linda Dolan, Yvette Taylor, with Kathy Dickey and Frank Peach being the newly elected Board of Trustee members. We posted our election official results on the 18th. All of our audits came back clear in terms of our ballots distributed to the ballots counted through our electronic voting machines. You'll read there, we did have a slightly lower turnout this year. So it was less than 2018, but more than, or about the same as 2014. So I think whether it was a result of the sources used to calculate the voting populations in those years, because BC Stats was used, whereas this year, given we had the census outcome from 2021 at hand, we just went with the census figure. Or could have just been that 2018 was actually the odd year for turnout, and we've kind of naturalized with what we saw in 2014. We did see in Toad River quite a bit lower turnout than we expected, as well as with the hospital and mail-in ballots. So we are going to recommend that in 2026, Toad River be offered postage paid mail ballots. It was a significant day in time. We had 2 employees spend 8 hours, basically time being up there for 8 voters. I understand the distance, but that's a pretty big burden to staff it. And also all the arrangements that go into offering any special voting opportunities, be it issuing ballots and things like that. So some of the new things we did this year included our new website. So that allowed us to showcase a lot of the election related information. It was simply organized with just running in the election, how to vote, where to vote, and working for the election. We did do all of the sort of normal types of advertising, social media, newspaper, etc. We also advertised for voting days in the Leisure Guide and our utility bills this year. We were happy to be able to host the general election, well, all of the advanced voting opportunities in the election at the rec center in the community hall, which gave us a ton more space. You know, coming out of COVID, it was nice to have all of that space for people to circulate and a bit more physical logistics, obviously, without having to occupy a working office with an election. So that was something different. Also, we did electronic voters registration. So instead of having people fill out clipboards and pencils and paper, we use the the electronic voting registration, which we were able to create our voters list in about half an hour versus hand entering 1,200 forms in a database. So that was nice. We did use the electronic tabulators again this year. They've been used for at least 2 elections prior to this. It allowed us to have our count and results available prior to 9 p.m. So when the polls closed at 8, that was much more efficient than days gone by where we were often, not we, it wasn't me, but they, poor souls, were counting ballots until 2 in the morning. So, and some of the other things. So this is the first year that we'd have ever offered curbside voting. So essentially, if a voter wasn't unable for whatever reason to enter the voting place, they could and did request curbside voting, where we actually took the ballot out to their vehicle and allowed them to do that. So that might be something that we offer next year. We did have some requests for additional special voting places, and just with the logistics, depending on the needs of those folks, it might be more feasible to offer curbside voting in a certain window of time so we can access voters a little more easily. So that's all I had on that. If there's any questions, you're welcome to ask. We do have the voters list and election materials available for inspection till November 18th.
Just a comment, I want to congratulate you and your staff for how efficient and how professional that election was run. I think it is really a credit to the organization and to you in particular, Ms. McIver, about how well that was done. So thank you very much. Any other comments?
I second what you said.
Carried. Thank you very much. Administration report number 82, grant application to UBCM Community Emergency Preparedness Fund. Mrs. Laval.
Thank you, Mayor. So this is a grant application into our usual source of funding, the UBCM Community Emergency Preparedness Fund. This one is coming out of the fire department to help fund some additional training for them as they go to meet the new firefighter training standards that have come out in the new playbook. So.
Any questions for Mrs. Laval? Very well. A motion, please. Moved by Councillor Gerwin, seconded by Councillor Penny. For the recommendation, I take it. All those in favor? Carried. Zoning amendment by law for 5751 Alaska Highway, site-specific propane retail, number 208-2022. Mrs. Adhikari.
Good evening again. As Council may recall, on September 26th of 2022, Regional Council gave first and second reading to the zoning amendment bylaw, seeking update of the zoning of the parcel located at 5751 Alaska Highway, and also adding a site-specific permitted use of propane retail on the site. For council consideration, public hearing notification was published, and notice to neighboring property owners were also delivered by mail on October 13th of 2022. So far, one comment from Fort Nelson Historical Society has been received, and the comment says they have no concern with the proposed zoning amendment. No other concerns has been received. And following the public hearing held prior to this meeting, Local Government Act concerning public notification has been satisfied. The zoning amendment is also was also subject to approval by the Ministry of Transportation and Infrastructure. The minister provided approval with comments on October 11th of 2022 as attachment 22, as attachment 2 included with the report. And the approval of the zoning amendment application by MOTI enables a local government to adopt the zoning amendment bylaw in compliance with the Transportation Act and the community charter. Yeah, this is all from my end. If there are any questions, they are very much welcomed.
Councillor Penny.
No, I don't have any questions. I was just prepared to make a motion for option number one.
There's no questions. I'll entertain that motion. Moved by Councillor Penny, seconded by Councillor Roper. All those in favor? Carried. Thank you.
Thank you.
Correspondence, BC Museums Association and Heritage BC, a request for travel bursary
Mayor-
support.
Mayor Foster, sorry to interrupt you, but we missed the permissive tax exemption bylaw,
Oh, I'm
number
sorry.
209 for adoption.
Thank you. No one speaking to that. I'll just ask for a motion then. Moved by Councillor Andrews, seconded by Councillor Souls. All those in favor? Carried. Thank you, Ms. McIver. Correspondence, BC Museums Association and Heritage BC, request for travel bursary support for the Northern Rockies region. Letter from Alison Bond, Deputy Minister for Children and Family Development. Letter from Mitzi Dean, Minister of Children and Family Development. Re the BC UBCM meeting follow-up. Northern Rockies Region Municipality, letter to Lisa Andres, Minister of Municipal Affairs, sections 781, request to write off uncollectible taxes. Letter from the Honorable Lisa Bear, Minister of Citizen Services, UBCM follow-up meeting. And invitation to Mayor and Council from Carissa Dickey, reading of She Woo My Teeth at the Phoenix Theater. The location has been changed from the library to Phoenix Theater. Are there any questions? Councillor Gerwin.
Can we send a copy of the letter from Mitzi Dean, Minister of Children and Family Development, to Fort Nelson Family Development, both to the board and to their executive director, Cindy Southwick, please?
Very well. I think that was the request we had at UBCM when the minister was talking about that. We asked her to write a letter to the individual. That letter was sent, but a good idea to send it to the board as well. Do we need a motion for that?
That's good to have a motion, Mayor.
Moved by Councillor Gerwin, seconded by Councillor Penny. All those in favor? Carried. Information package, council information package for October 12th, and council information package for October 19th, received for information. Additions by Mayor and Council. My addition is the lack of representation on the Northeast Provincial-led Forest Council. Minister of Forest has initiated a Forest Council that is dedicated to assisting government in ensuring programs are targeted effectively in response to community needs and priorities. And it's chaired by Doug Routley, the Parliamentary Secretary for Forest. Council includes 18 members from the board for the board from sections of BC, including local governments, Indigenous communities, forest industry, and labor representatives, academics, and non-governmental organizations. The Northeast part of British Columbia has been totally left off this board. Not just our region, but also Fort St. John, Dawson Creek, and the entire northeast of the province. And our MLA, Dan Davies, has spoken out about this, as well as Mayor Ackerman and myself. I could read you the list here of people that were appointed to the board from some places like Richmond, Surrey, Vancouver, Comox, but not the Northern Rockies. And I think this is probably is. Anyway, I think given that the northeast part of British Columbia produces a huge amount of timber, maybe not our region, but it spoke to some such things as the impact on communities of boom and bust, and what happens to communities, and we're the poster child for that, and we've been left off, and so has Fort St. John, Dawson Creek, etc. Mackenzie has been left off. Everything east of Prince George and north of Prince George is just missing from this. And the only regions they've looked at is the southern part of British Columbia. And it's a mystery to me why you would appoint somebody from Surrey and Vancouver and not somebody from one of these forest communities. So I'm not sure where council wants to go with this. We could write a letter expressing our disappointment with the provincial Minister of Forests for not including the Northeast, and echo some of Dan Davies' comments as well. Councillor Penny.
I think for sure we should send a letter. Sitting here and stomping our feet is not going to get us anywhere. So. It's ridiculous.
Well, anybody else? Any comments? Councillor Andrews.
Yeah, I would also be in favor of sending a letter to request at least an explanation as to why the oversight. I've had at least 3 community members express their concern in this matter as well. So I would like to have a letter written for sure.
Any other comments? Very well. Councillor Andrews, you make that motion?
Yes, please. I'd like to
Councillor
have
Penny,
a
second
letter
that?
written.
Okay. Go crazy. All those in favor? Carried. Councillor Gerwin.
Okay, great, thanks. So I just want to begin by thanking each of you for agreeing to add this story to tonight's agenda. As requested by the resident, I have forwarded a copy of the letter to each of you, and I have included staff in that as well. I would just like to begin speaking tonight and by expressing my deep sadness, and I hope I'm not going to cry, but I might. My deep sadness and regret for how this resident has been treated by 2 provincial organizations, BC Emergency Health Services and Northern Health. No one should be subjected to what this resident had to endure. I am heartened to know that the local services did a great job in caring for this resident. So I thought in order to facilitate a discussion tonight, we could organize it in 2 separate parts. So I would like to talk about the 911 response first, and then maybe we could deal with the Northern Health. I won't go over all the details because I know you've all read it, but just to highlight some of it. So October the 11th, the call was made to 911 at approximately 1 p.m. The resident told her story, and the call was forwarded to, I'm assuming it was BC Emergency Services, but I don't know that for sure. Story was told again. The caller was told that they would have to speak to the nursing department and somebody would call them back. So she was actually disconnected from, I think it's BC Emergency Services. And a little bit of research I did, I wonder if she wasn't transferred to 811, the nursing hotline, I don't know. She waited 5 or 10 minutes. The nursing department called her back. She's told her story for a 3rd time, and the decision was made to dispatch the ambulance. So it was 40 minutes from when she first called until the ambulance showed up in her yard. So a few questions that I had just on the 911 part is, has the emergency services changed their response protocol? Where is this nursing department come from? I think maybe she was transferred to 811. But I don't know. So I think it would be worth investigating. Has the protocol changed, or why was this patient assigned such a low acuity? Our fire department was never called. Yeah, so I kind of had that question. And then is a 40-minute response time, the standard? And then to have to outline your story 3 separate times, the patient was in excruciating pain. So to have to, and home alone, I might add. And I really feel like the severity of the medical distress was not heard. And I'm just wondering if it would be worth somehow going through the investigative process to determine how it was misdirected. I don't know if anybody has any comments just on the 911 portion of the resident's letter.
Councillor Roper.
Yeah, I don't think that the issues that she experienced with 911 are isolated to this one incident. I think there's been other cases as well from the feedback I've been hearing. So, I mean, we're pretty new to this 911 I would like to get some more information on how other callers have been treated, because I've received a little bit of feedback and it hasn't been great.
Counselor Andrews.
Yeah, I can echo that as well. I've had many accounts of people using the 911 service and being very disappointed, getting nowhere. And most people have told me they are just going to call our fire hall directly because they get better service, they get taken care of, and there's zero faith in the majority of the people I talk to in our 911 service. So I think we definitely need to be contacting them and figuring out where the hookups are, what's going on, because it doesn't seem like it's a fulsome service that we can depend on.
I just want to just confirm that this resident received a good response from 911. So the call goes into the Grand Prairie, right? And that she was transferred directly to, I believe it's BC Emergency Services, and that's where the problem began. So she felt she was answered appropriately on the 911 call, but it was that first transfer where things began to go off the rails.
Counselor Penny.
I was actually going to add, because there has been a couple of 911 calls since we initiated it that I heard very similar reviews on, but it turned out, and a couple that I had actually questioned staff about, that it was after 911. So they had,
Yeah.
just like
we're
you're
just
saying, it was like,
lumping it
they got the
together.
call, they moved it to the appropriate, and
Yeah.
went to the appropriate place, and from there, it was,
At a minimum, we should find out what the protocols are for the BC Emergency Services, because I mean, this isn't acceptable. Whatever happened here, why it happened, did they not take the call seriously? Did they think that this was a trivial? Why did it take 40 minutes to get to her? I'd like to know what the protocols were. Why did you have to
Just
explain
nursing,
yourself
yeah.
3 times to 3 different people? When was the ambulance dispatched? All those things.
Yeah.
And who was responsible for dispatching the ambulance? And I don't know if we can, how much of that is public knowledge, or how much of that we can get, but we should certainly look into it and see what we can detect from that.
Okay, so then let's go to, oh, sorry, did you want to go, Councilor?
are we going, do you want to just wait, or are we going to make a motion to actually have this actually investigated?
Sure,
Like,
we can ask for a motion
or
for
would
that.
you, because you did break it up into 2 pieces,
I
so I
did
didn't want to
break it
move
into
on,
two.
and, or do you think it would all be encompassed?
I think maybe at the end, we can like have some sort of a motion to say that we, because I think that there's only so much that we can do, and then it's up to the resident to go through the process. And I have some concerns about having gone through the complaint process. My own case of that, I felt I was just re-traumatized by it all. So, but there is some things that we as an organization can do in terms of the 911 service, like we can determine that everything went well out of the Grand Prairie office, which I'm sure it did. But we can also investigate what this new nursing option is. Although I have since discovered with conversations that I believe what happened is she got referred to 811, which was, but we can determine that. And Mr. Barry, go ahead.
Just a couple comments, just since you're in the discussion here. So in terms of 911, 911's responsibility is to take a call, and then they don't dispatch. They actually transfer the call to the appropriate agency. So in this case, that would be BCEHS. And then when the call is accepted on the BCEHS side, the 911 operator disconnects the call. If there's a delay in reaching the dispatcher, or in this case, BCEHS dispatch, then the 911 operator remains on the call for however long it takes for that call to be accepted before the call is before the 911 operator disconnects. 911 doesn't have any control over the reaction time or the abilities or the how busy or whatnot that another organization or agency is. So when a fire call comes in, they transfer the call to our fire department and we respond accordingly. In regards to this situation, we do have the ability to confirm the call, the time, and how it was transferred. Because a lot of times we do receive I'll say just from, I mean, and we can't, I mean, obviously there's privacy requirements and whatnot that can't be shared publicly, but I can say that any of the complaints that we received specific to 911 have typically been past the 911 call,
Yeah.
right? Even though the assumptions made when they're calling 911, they think they're calling an organization, that they're basically a call transfer system. It's the ability, instead of having to figure out what number do I have to call to get emergency services to my doorstep or whatnot. It's you dial 911 operator. In this case for us is Grand Prix Fires, our PSAP. And then that call gets transferred to the appropriate agency. And then that agency, in this case was BCEHS, they would have protocols in terms of when they, dispatch their own cars, which would be BC ambulance, but also there's a matrix involved in terms of when Northern Rockies Fire Rescue gets dispatched from BCHS based on a matrix when it comes to the acuity and the seriousness of the injuries.
And that's where we do have input. So years and years ago, we had, anytime an ambulance was called, our fire rescue went out as well. Years ago, when BC Emergency Services was having a lot of trouble in servicing the area. And then as things have improved there, that level of service has been reduced, right? Because it's at the cost for the Northern Rockies. And so that is something that we can talk about. I would suggest that we get as much investigation done as possible. And then I would at some time would like to have a future discussion about whether we need to change that acuity level. So do we want our fire rescue to be dispatched more often? You know what? Because like right now, if it's like life threatening or whatever the matrix says, then they are automatically dispatched. But this call taker didn't give that level of acuity to this patient. So our fire rescue was not called. So she was home alone for 40 minutes while she waited. So yeah. Okay, so on to Northern Health, or do we want motions? Let's just go on and then we'll see at the end. Okay. Okay, so after assessment at the Fort Nelson Hospital, and when you read the letter, you could hear how complimentary she was to the service that she received at the Fort Nelson General Hospital. And the patient is assessed and tentative diagnoses, and she's informed that she's going to be medevaced to Fort St. John Hospital. And this is around 3 p.m. on the 11th. So 3 p.m. Okay. 10:30 p.m. an ambulance arrives from Fort St. John to transfer the patient back to Fort St. John, to the surprise of everybody, because everybody's waiting for a plane. Nobody knows ground transport's coming. So anyways, this ambulance shows up and off she goes with no pain meds to take along the way. So you read what the tentative diagnosis was in the letter, and very painful. So October 12th, next morning at 2:30 a.m., the patient arrives in Fort St. John, 4 long hours on the road, no pain meds. And the patient is told that they need a scan. She couldn't remember what kind of a scan it was to confirm the diagnosis that was made at this hospital, right? So she receives the scan at 2 p.m. So remember, 2 a.m., 12 hours later, with apologies that they had forgotten about her. Approximately 3 p.m. on the 12th, patient is advised that they need surgery and is ground transported to Dawson Creek to have the surgery. At this time, she's trying to make arrangements, childcare, get her husband who works out of town to come to Dawson Creek to pick her up. And she's told that she will have the surgery and she'll be released on Friday. So she makes those arrangements. She arrives in Dawson Creek approximately 5 p.m. on the 12th. Surgery takes place at 10 p.m. So another 5 hours she waits. Now, if I've done my math right, and somebody can check me up on this because you know me and maps and math, I think that's approximately 31 hours after the initial diagnosis here at the Fort Nelson General Hospital. So now we're Thursday, October 13th, less than 12 hours post-surgery, the patient is discharged. So remember, she was supposed to be discharged on the Friday. That's when her ride's coming to pick her up. She's discharged on Thursday in Dawson Creek. And so I don't know, you gotta love Facebook because somehow the patient found somebody that happened to be in Dawson Creek that could pick her up and take her to this hotel room to await the arrival of the husband. She's not escorted out of the hospital. She's given her duffel bag, sent down the hallway, and she waits outside on a bench after surgery to get picked up. And I think it's really important for us to remember, and I know you all get it, that she's by herself this whole time in pain, right? And then just left to sit on the bench. So I have a few questions about this, like why ground transportation as opposed to air? Probably because there was no plane. How many times do we hear it? But really, I just struggle with that. And then, I mean, I don't want to, say what the diagnosis was. I'm trying to be as confidential as I possibly can, but the doctors made the call here that this was going to need surgery. So why would you go to Fort St. John where you can't have the surgery? Why weren't you taken directly to Dawson Creek or to Prince George where everything could be done in one place? I think that that's a question that we can ask. And then I just am really struggling with the 31-hour wait, 3 ambulance transfers, 5 hours of travel for surgery. If air transportation continues to be unavailable, what are our options? We think the Villars Air option we've got going, but we don't have enough paramedics because had 2 paramedics gone with this patient from here via Villars Air would have left us short. I mean, everything we knew was going to happen is certainly coming to be. And if the province is going to stick with this regional model of healthcare, shouldn't patients be repatriated back to their home communities? Is that not only humane? And then I did have the question about should the NRM go back to our local fire rescue crew responding to 911 calls? I understand that there's a whole budgetary considerations and that could then leave us short in the fire hall. So I know that that's a way complicated issue. And then I think this is my last comment. It's to date, our quest has been to receive equitable access to healthcare services. And I'm suggesting that perhaps we need to change that tagline to equitable access to humane healthcare and transportation services. So I don't know what we can do. I mean, we've been at this for a long time and our hands are tied. I think there's a few investigation points we can do ourselves. I think that we can find out the numbers for this patient to complain to Northern Health and to BC Emergency Services. We can't do that on her behalf. I have gone down that road before and it has to be the person that experienced it. So we could find all of that information and give it to her and leave it to her to decide whether she wants to go down that route or not. So that's that report on that sad story.
I guess one of my concerns about this story was the part where someone told her that, oh, sorry, we'd forgotten about you.
For 12.
And I'm wondering, without getting into the machinery of Northern Health, whose responsibility was it to make sure she wasn't forgotten? And I don't know the answer to that question, probably never learn that. The other question I have is, when the time she got to Fort St. John or Dawson Creek, she was under a doctor's care, presumably in Fort St. John. How this can go 31 hours. And I'm sure that if you asked enough questions, a doctor would say, well, you're not a doctor, I'm a doctor. And I know that, she can do this or do that, or this is the proper procedure. So I'm a little concerned about the care she got when she got there from the physicians and from the nurses, being forgotten, being left that long without making arrangements to go to someplace where she can get the surgery that was needed. I don't know where the failings of the system were, and I don't know how much our municipality can look into this without running into a wall that says, sorry, you're not the patient. There's nothing wrong with writing some letters and asking some questions. I just think that sometimes you're going to run into this wall where, I'm sorry, I can't talk to you about that. That's patient confidentiality. Or you're going to run into a wall that says, well, look, she was under a doctor's care and this is what we decided to do and you're not a doctor. So I agree with Councillor Gervin. We should make what inquiries we can. I'm a little skeptical about how much we're going to learn behind that. And I would encourage us to keep in contact with this person to see what they learn through their roots, because I think they will get stonewalled. My personal opinion. Councillor Penny.
It's extremely unfortunate, but this is not a one-off case in a Canadian health system right now. I mean, it's unbelievable. I mean, you hear stories like this throughout the country about how people are left in hallways and forgotten about. There was a past resident of Fort Nelson that in his 80s who was left, albeit to pass away in a hallway in Vancouver one time, and they just assumed he was old and he was on his way out anyway. Very vibrant man, but how I don't think that we have much mechanism to cure this. But when we were speaking earlier about maybe assistance somewhere along the way for when it comes to anything else, but perhaps there's a point, because I think what really happened with this particular resident is that she was alone. And if you don't have somebody there to advocate for you, that's up and mobile in that hospital, this is what can happen. And I don't know how that mechanism can happen through Northern Rockies, but if we could make some sort of connection in these places that our residents normally get transferred to, perhaps we could have an advocate, that we could have somebody local on the ground there that we could at least put a resident in contact with if they end up in a different community, right? I mean, we know they're going to end up in Fort St. John, Dawson Creek, Prince George, Vancouver, right? I don't know how we go about doing something like that, but maybe that's first starting point, is that we find somebody or some department that we can have as an advocate for these people that get sent out, because they said that is the biggest fear. If you don't have an advocate on your side, if you're sitting there and you're incapacitated and can't speak for yourself, or you don't know who, or you're shy, or whatever it might be, or you're in so much pain and you don't have somebody there that can run and find a nurse or go find a doctor or ask questions and find out what the heck is going on, this is what can happen. So maybe that's something we can look at.
So Councillor Penny, last week in Quebec, individual 16 hours in emergency, and they passed away. So they were sitting in an emergency room for 16 hours and they ended up dying. The healthcare system's in tatters right across the country. Councillor Souls.
We've always had the principle of finding, along with our questioning, we provide some solutions. And in this case here, there's a reason why I'm thinking in the back of my head right now about how glad I am that we've been working on the idea of a healthcare recruitment personnel. The real issue is that this couldn't have been managed right here. That's the real issue. We talk about equitable healthcare. We talk about not being able to have babies in our community when that's fairly normal to have babies in the world. It's been happening for a long time. And we really are, we complained when centralization of services took place, saying, okay, if you're going to centralize services, then you have to centralize that, create access for the people that get left behind. So now we have a centralized service and no access. And so the real fix for this problem is recruiting the right people for a healthcare system here that can manage things like this, because this is not that complicated. So we need to talk like that. We need to say this is the failure, because it's really easy to identify the failures in that letter. The failures are everything that took place after she left Fort Nelson is a failure, one after another. Let's talk about those failures and say, here's the solution.
So am I hearing you say that with permission from the resident, we should write a letter to the Minister of Health outlining what happened here?
Yes, and
Would you like
she,
to make that
because,
motion?
yes, I actually do. I would like to. And I think like, I know this person, but whether maybe that we could, of course, we need to talk to her
Yeah, for
first.
sure.
Nothing goes without that. And if she's willing to say, here's what we come up with, then we can write a letter.
Because
And
we,
outline all the failures and give the solution. Because that is the solution. And I don't know how else you can approach this, except no matter how we communicate, if we do not promote a solution, a local based solution for this kind of a problem, we are giving ground to having less and less services moving forward.
Councillor Roper.
I also think that we perhaps need to aggregate more information from other residents. It'll be really easy for Northern Health to consider this a one-off, something that fell through the cracks, but I have a feeling that there's a pattern here that is going to just be repeated. And we don't want to give them the opportunity to give us any excuses. We're gonna have some hard questions for them, and the more data we have, I think the better of a case we can make. I think that a lot of people are falling through the cracks, especially in our region. And I think it's important that we know about it. We're discussing it right now. We're having conversations right now. What aren't we aware of officially?
Any other comments? Councillor Gerwing.
yeah. So I think there's a motion on the floor, right?
Yes, I make a motion that we contact this person and ask if we can compose a letter. As she says, it's not okay. She used the words, this is not okay. Okay, so if we can get her to work with us in composing a letter, we should outline the failures of the system after Fort Nelson and propose a solution.
Okay, I would second that motion.
Very well. All those in favor? Carried.
Okay, and then, sorry if I may,
Go ahead.
just wanted to address Councillor Roper's comment about collection of stories. We have bots, and it takes, it's not an easy thing for people to get up and tell their story, right? And have action taken on that behalf. So it is, I've been collecting them for years, and it is really, really difficult for people to do that. So when we get one, and then I think it's so important that we actually go as far as we can. And if the resident is willing that she goes through, she's got 2 avenues here now. We're both with BC Emergency Services and with Northern Health. I think quality of care, I think yeah, so then I would make a motion that staff connect with the resident, or I will, whatever, and give her the 2 places that she can go through her process as well.
Do I have a seconder for Councillor Gerwing's motion? Seconded by Councillor Andrews. All those in favor? Carried.
And sorry, one more, if the letter can also include something about repatriation, or a separate letter if you prefer, Councillor Souls. I think it's really important that we continue to drive home the point that, being left on the bench outside the hospital waiting for somebody to pick you up isn't an acceptable way.
Can we add that to the second motion for Councillor Gerwing?
Okay, thank you. And then, sorry for the additions, but Dr. Mostert contacted me, and he has requested, as if you will remember, council has offered assistance to Dr. Mostert wherever he needs it. And so he has requested our assistance in getting Dr. Fury's work visa extended until the end of 2023. We are all very aware of the doctor's situation in Fort Nelson, and also that Dr. Fury has been here many, many times over the years. I would like to propose that we develop and execute a plan of assistance that will hopefully see Dr. Fury's work visa extended until December 31st of 2023, or as much time as they will give us, including approving an amount of money. And I don't know how much money that we should approve, but maybe Scott, Mr. Barry can help me out with that. To aid in the procuring of legal services and or immigration support services may be required, and that the timeline for this support is now. So I think that the reason why I'm requesting that is because I don't think we have anybody on staff with the expertise in terms of immigration. And so I think a lot of time could get gobbled up where we could otherwise hire a lawyer or an immigration caseworker that can do all of that for us in order to help Dr. Fury get this extended. Because if he has to go through the whole process again, it was really long this time and it's gonna be even longer next time. So,
Counselor Penny.
Are you making the motion then?
yeah,
I'm gonna second.
okay.
I guess I'm just wondering, perhaps we should reach out to Dr. Fury and find out what assistance he's requiring. Mr. McIver?
So I did reach out to Dr. Forey because there's some obvious things about extending work permits. And the simple question I wanted to know was whether he'd applied to extend it yet, because that wasn't clear in Dr. Mostert's request either. So I think just that initial discussion with Dr. Forey is good to kind of get the facts together. And then from there, has the due process been followed, and are we at a point of requiring some other intervention? Or I'm not certain if all of the proper steps have even been followed at this point. So
That's what I'm wondering is, I think about conversation with Dr. Forey to find out where we're at here, and then how we can be of assistance to him, to the staff there. Before we start hiring lawyers, if we don't know if that's what's required.
I think though the motion was that if it was needed. Right? Just so it doesn't have to come back again and go back again. So there's no time lost in here, I think. Is that how I heard the motion?
Did Dr. Fury answer you yet? Okay.
Okay, Mr. Barry.
No, just to add to that, like myself and Jay did chat Friday, and in order to try to really understand what our solution is, we need to understand the problem is and what those gaps are. So I think one of the first things, a broad resolution gives us some flexibility for sure. But there's some fact finding that needs to occur on our end to understand where the challenges are, what they are, and if it's a challenge with the system or if due process has been followed or whatnot. So that's the first step. Obviously, we'll just wait for information to come back from Dr. Ferd.
So as far as a broad motion, what should we be looking at here as far as, I mean, I guess initially we need to contact Mr. or Dr. Forey and then look at solutions to advocate on his behalf. Would that be?
Well, I think, so the motion that I put on the table is that I would like to propose that we develop and execute a plan of assistance. So I guess that plan would include investigation as to what assistance is needed. And then I tagged on the other part about coming up with a dollar figure so that if after investigation, it's determined that whatever is stalled wherever and we need some legal assistance or assistance from an immigration caseworker, that we had the flexibility to do that without waiting 2 more weeks to come back to council or however long that would take. I thought we could just preempt all that and get her done tonight and use it if you need it. And if you don't, no harm, no foul.
Councilor Penny.
Just to add to that, I mean, it's going to be more than 2 weeks before any other decisions made at this table, right? So, whatever. When we talk about healthcare in our community, and we're talking about helping our residents, this is the chance that we have to push that forward. So
Very well. So the motion by Councillor Gerwing and seconded by Councillor Penny.
can I have a dollar amount in that resolution?
I don't know, $7,000.
701, Bob.
There we go.
I'll see your 7 and I'll raise you 2, 703.
I'm fine with the $7,000 amount. I was struggling with trying to figure out a dollar amount. I like the motion. So,
Yeah, and I think if it ends up being more than that, perhaps we could do an email poll and ratify it at the next meeting, whatever it takes.
Very well. All those in favor of the motion? Carried. Council reports. Any council reports? Very well. Are there any questions from the media? Public? No? Very well. I'm going to ask for a motion then that the meeting be closed pursuant to section 91C of the community charter. Could I get a motion, please? Moved by Councillor Andrews, seconded by Councillor Souls. All those in favor? Carried. We call this regular council meeting. And Ms. McIver, is there anything to rise and report?
Yes, so from the regular in-camera regional council meeting, moved by Councillor Gerwing, seconded by Councillor Penny, that Desiree Bardwell's application to the Northern Rockies Recruitment, Retention, Education and Training Incentive Program be approved in principle subject to confirmation of eligibility with the health employer, carried unanimously. Risen and reported from the in-camera personnel regional council meeting that the moved by Councillor Roper, seconded by Councillor Penny, that the October 2022 management hours of work and overtime policy be adopted as presented, carried unanimously.
Thank you. Having completed our business, we are adjourned.